When I would drive outside the plantation or the development, I would pick up people who were walking alongside the road and give them a lift to wherever they were going, back to the house or to work site. And I invariably asked them where they got their health care, and they invariably said, I don't get any. That to me was unbelievable. Well, we had two problems. We had the problem of those who had no access to health care, and we had the problem of those who lived on the island who had no easy way to deliver it. So I brought those two problems together, and I made a solution out of it, which we call the Volunteers in Medicine Clinic. And now I'm told now that every person that lives in our town has access to health care, and we are the only town in the nation that can declare that. And based on two mottos, the Golden Rule and the Second Commandment, it was a very simple but powerful conclusion that we came to, and that was, we do not want to perceive them as patients, diseases, or illnesses. We want to perceive them as friends and neighbors who don't feel well and are coming over to us for help.
Hello, welcome.
When they arrive at the door, they're not perceived as a patient. They're perceived as a friend and a neighbor. And then someone greets them. You know, if someone came to your house, you wouldn't stand inside your living room and wait for them to come inside your living room before you say hello. We go to the door to greet them. And there's a greeter there. And that greeter's responsibility is to say something along the lines, how sorry we are you don't feel well, but how pleased we are you came to this clinic, because this is your clinic. Come in, let's see if we can help you. We have 41 million without health insurance that are medically underserved, and they're scattered through every state, every city, every town, and every village in the United States. We're not rushed to see patients. We don't have to see a patient every 12 minutes in order to make the budget. If we have to take 20, 30, 40 minutes time, that's okay. It's quite all right.
It's very affirming to practice in a setting where so many people are interested in helping out.
Good morning.
I think that any community that takes this on is taking on something that will give them greater personal satisfaction if you're working with it, and certainly benefit to the community, way beyond whatever you may measure or survey or anything else.
Yeah, that's right.
I think every community has a Dr. McConnell. They just have to discover it.
What we're going to do is to take these plans. When I realized the magnitude of the need and the depth of it, I couldn't do otherwise. And having done otherwise, having done it, having been involved in it and created it, it's not fun. It's something deeper and more enriching than that. It's joy at its deepest level.